It has been a long, tiring week working a new job at the local supermarket. You are a young man who started working and throughout the week was tasked to carry and sort out some heavy boxes containing goods. Today, on your day off, you have decided to visit the pharmacy to buy something to relieve the intense muscle pain on your lower back that you have been feeling for some time now. You remembered bending forward to lift the heavy boxes at work in an awkward position a few days ago.
So what can I do?
Hello and welcome. My name is Farah. I'm a pharmacist and today I will educate you on the use of Salonpas, a medicated patch that can help relieve your muscle aches and pain. Low back pain is one of the most common musculoskeletal conditions affecting the adult population, with a prevalence of up to 84%. The single most common cause of low back pain is a torn or pulled muscle or ligament. This could often happen as a result of lifting heavy objects, falls, poor posture over time, such as sitting down long hours doing work at the office, sports injuries, and so on. Now, in your case, your lower back pain is caused by a strain as a result of poor posture and body mechanics when you lifted heavy boxes at your new workplace a few days ago. It is a common complaint that you experience intense pain with back stiffness that keeps you from moving well, difficulty to maintain a good posture, and also intense bouts of muscle tightening and relaxing problems. So now, introducing Salonpas. This Salonpas patch features a transdermal drug delivery system, which is a technique of delivering medications via the skin, whereby an anti-inflammatory medicine called methyl salicylate is spread across a thin and stretchable patch that, when applied directly to the skin, enables the medicine to be delivered directly to the site of pain. So this patch can be used to temporarily relieve your back pain and also relieve other aches and pains that are associated with muscle fatigue, muscle pain, bruises, sprains, strains, and arthritis.
Alright, so how do I use this patch?
The patch is very easy to apply, simply by removing the medicated layer from the backing film and sticking it to the skin. The patch is also thin and flexible, which allows it to stick firmly to any shape of the body, even over the joints. You can apply the patch on the affected area using one patch at a time. A single patch could be applied for up to 8 to 12 hours. If pain occurs again after 8 to 12 hours of applying the first patch, a second patch could be applied. Remove the first patch before applying a new one. Do not use more than 2 patches per day. You should use the Salonpas patch only when needed. If you are on a dosing schedule, skip any missed dose. Do not use 2 patches at one time. And remember, this patch should be applied only for external use. You should not use it on any open wounds, irritated skin, eyes, or mucous membrane. Before using this patch, there are several precautions that you should consider. First, the Salonpas patch is suitable for adults and should not be used by children and adolescents under 18 years of age. You should not use the Salonpas patch if you have allergic conditions or a history of allergy to painkillers or any medicines to reduce fever. For example, if you have an allergy to aspirin or ibuprofen. Next, you should also avoid using the patch if you have or have had stomach ulcer or bleeding, chronic indigestion, and any bleeding problems. Additionally, if you are currently taking a medication known as warfarin, you should avoid using the patch excessively as it can increase your chances of bleeding. Lastly, the Salonpas patch is not recommended for use if you are currently pregnant or breastfeeding, and should be especially avoided if you are pregnant in the 3rd trimester.
When should I stop using the patch?
You should stop using this patch and call your doctor at once if you develop excessive skin irritation like rashes, itchiness, pain, redness, swelling, or blistering. Get emergency medical help if you have signs of an allergic reaction, such as hives, difficulty breathing, and swelling of your face, lips, tongue, or throat. And if your pain does not improve after 3 days, or if your symptoms get worse, stop using this patch and call your doctor. Now finally, where can you get the Salonpas patch? You can purchase this patch at your local pharmacy stores, supermarket, and convenience stores.
Okay, great. Thank you for the information.
No problem. Wishing you a speedy recovery. I advise you to stay active and do some light back stretches. These will definitely help speed up your recovery too. It is difficult to prevent back pain, but the following tips may help reduce your risk. Do regular back exercises and stretches. Stay active. Doing regular exercise can help keep your back strong. Adults are advised to do at least 150 minutes of exercise a week. Avoid sitting for long periods. Take care when lifting. Check your posture when sitting, using computers, and watching television. Ensure the mattress on your bed supports you properly. And lose weight through a combination of a healthy diet and regular exercise if you are overweight. Being overweight can increase your risk of developing back pain. Now then, before I go, let's have a quick true or false quiz session. Quiz 1. If you have a history of gastrointestinal ulcers, you should not use the Salonpas patch. Is this true or false? True. The Salonpas patch contains a medication called methyl salicylate, which is a non-steroidal anti-inflammatory drug, or NSAID for short. NSAIDs commonly cause side effects such as gastrointestinal toxicity, which leads to stomach ulcers or bleeding. So if you have or have had gastrointestinal ulcers, using the Salonpas patch may increase your risk of further ulceration or bleeding. Quiz 2. You can use the Salonpas patch on an ongoing basis for more than 3 days in a row. True or false? False. The patch temporarily relieves symptomatic pain associated with strains and sprains. Pain relief generally occurs within 1 hour of application, but depending on each individual, you may feel the pain relief shorter or longer. So now, if your symptom persists beyond 3 days, you should stop using the patch and seek medical attention from your doctor. Quiz 3. Bed rest speeds up the recovery of low back pain. Is this true or false? False. As I have advised, stay active and do some light back stretches. This will actually help reduce the pain as well as improve your muscle strength and flexibility to speed up your recovery. Studies have shown that patients who were asked to rest and stay in bed have a slower recovery rate compared to patients who stayed active. So resume your activities as normal and tolerated, and also engage in slow, easy stretching or exercises. But of course, avoid any strenuous activities or work.